Section 28 of Gray's Anatomy, Part 2. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by Morgan Scorpion. Anatomy of the Human Body, Part 2 by Henry Gray. Muscles of the scalp, eyelid, and nose. 4. The fasciae and muscles of the head. A. The muscles of the scalp. Epicranius. The skin of the scalp. This is thicker than in any other part of the body. It is intimately adherent to the superficial fascia, which attaches it firmly to the underlying aponeurosis and muscle. Movements of the muscle move the skin. The hair follicles are very closely set together and extend throughout the whole thickness of the skin. It also contains a number of sebaceous glands. The superficial fascia in the cranial region is a firm, dense, fibro-fatty layer, intimately adherent to the integument, and to the epicranius and its tendinous aponeurosis. It is continuous behind with the superficial fascia at the back of the neck and, laterally, is continued over the temporal fascia. It contains between its layers the superficial vessels and nerves and much granular fat. The epicranius, occipitofrontalis, is a broad, muscular fibrous layer which covers the whole of one side of the vertex of the skull from the occipital bone to the eyebrow. It consists of two parts, the occipitalis and the frontalis, connected by an intervening tendinous aponeurosis, the galea aponeurotica. The occipitalis, thin and quadrilateral in form, arises by tendinous fibres from the lateral two-thirds of the superior nuchal line of the occipital bone and from the mastoid part of the temporal. It ends in the galea aponeurotica. The frontalis is thin, of a quadrilateral form and intimately adherent to the superficial fascia. It is broader than the occipitalis and its fibres are longer and paler in colour. It has no bony attachments. Its medial fibres are continuous with those of the procerus. Its immediate fibres blend with the corrugator and orbicularis oculi, and its lateral fibres are also blended with the latter muscle over the zygomatic process of the frontal bone. From these attachments the fibres are directed upward, and join the galea aponeurotica below the coronal suture. The medial margins of the frontalis are joined together for some distance above the root of the nose, but between the occipitalis there is a considerable, though variable interval, occupied by the galea aponeurotica. The galea aponeurotica, epicranial aponeurosis, covers the upper part of the cranium. Behind it is attached, in the interval between its union with the occipitalis, to the external occipital protuberance and highest nuchal lines of the occipital bone. In front, it forms a short and narrow prolongation between its union with the frontalis. On either side it gives origin to the auricularis anterior and superior. In this situation it loses its aponeurotic character, and is continued over the temporal fascia to the zygomatic arch as a layer of laminated areolar tissue. It is closely connected to the integument by the firm, dense, fibro-fatty layer which forms the superficial fascia of the scalp. It is attached to the pericranium by loose cellular tissue, which allows the aponeurosis, carrying with it the integument, to move through a considerable distance. Variations. Both frontalis and occipitalis vary considerably in size and in extent of attachment. Either may be absent. Fusion of the frontalis to skin has been noted. Nerves. The frontalis is supplied by the temporal branches of the facial nerve, and the occipitalis by the posterior auricular branch of the same nerve. Actions. The frontalis raise the eyebrows and the skin over the root of the nose, and at the same time draw the scalp forward, throwing the integument of the forehead into transverse wrinkles. The occipitalis draw the scalp backward. By bringing alternately into action the frontalis and occipitalis, the entire scalp may be moved forward and backward. In the ordinary action of the muscles, the eyebrows are elevated, and at the same time the aponeurosis is fixed by the occipitalis, thus giving the face the expression of surprise. If the action be exaggerated, the eyebrows are still further raised, and the skin of the forehead thrown into transverse wrinkles, as in the expression of fright or horror. A thin, muscular slip, the transversus nuchae, is present in a considerable proportion, 25%, of cases. It arises from the external occipital protuberance or from the superior nuchal line, either superficial or deep to the trapezius. It is frequently inserted with the auricularis posterior, but may join the posterior edge of the sternocleidomastoideus. 4b. The muscles of the eyelid. The muscles of the eyelids are levator palpebrae superioris, orbicularis oculi, corrugator. The levator palpebrae superioris is described with the anatomy of the eye. The orbicularis oculi, orbicularis palpebrarum, arises from the nasal part of the frontal bone, from the frontal process of the maxilla in front of the lacrimal groove, and from the anterior surface and borders of a short fibrous band, the medial palpebral ligament. From this origin the fibres are directed lateralward, forming a broad and thin layer, which occupies the eyelids of palpebrae, surrounds the circumference of the orbit, and spreads over the temple and downward on the cheek. The palpebral portion of the muscle is thin and pale. It arises from the bifurcation of the medial palpebral ligament, forms a series of concentric curves, and is inserted into the lateral palpebral raphe. The orbital portion is thicker and of a reddish colour. Its fibres form a complete ellipse without interruption at the lateral palpebral commissure. The upper fibres of this portion blend with the frontalis and corrugator. The lacrimal part, tensor tarsi, is a small thin muscle, about 6 mm in breadth and 12 mm in length, situated behind the medial palpebral ligament and lacrimal sac. It arises from the posterior crest and adjacent part of the orbital surface of the lacrimal bone, and, passing behind the lacrimal sac, divides into two slips, upper and lower, which are inserted into the superior and inferior tarsi medial to the puncta lacrimalia. Occasionally it is very indistinct. The medial palpebral ligament, tendo oculi, about 4 mm in length and 2 mm in breadth, is attached to the frontal process of the maxilla in front of the lacrimal groove. Crossing the lacrimal sac, it divides into two parts, upper and lower, each attached to the medial end of the corresponding tarsus. As the ligament crosses the lacrimal sac, a strong aponeurotic lamina is given off from its posterior surface. This expands over the sac and is attached to the posterior lacrimal crest. The lateral palpebral raphe is a much weaker structure than the medial palpebral ligament. It is attached to the margin of the frontosphenoidal process of the zygomatic bone, and passes medialward to the lateral commissure of the eyelids, where it divides into two slips, which are attached to the margins of the respective tarsi. The corrugator. Note 79. The corrugator is not recognized as a separate muscle in the basal nomenclature. End of note 79. Corrugator supercilii is a small, narrow, pyramidal muscle, placed at the medial end of the eyebrow, beneath the frontalis and orbicularis oculi. It arises from the medial end of the superciliary arch, and its fibres pass upward and lateralward, between the palpebral and orbital portions of the orbicularis oculi, and are inserted into the deep surface of the skin above the middle of the orbital arch. Nerves. The orbicularis oculi and corrugator are supplied by the facial nerve. Actions. The orbicularis oculi is the sphincter muscle of the eyelids. The palpebral portion acts involuntarily, closing the lids gently, as in sleep or in blinking. The orbital portion is subject to the will. When the entire muscle is brought into action, the skin of the forehead, temple, and cheek is drawn toward the medial angle of the orbit, and the eyelids are firmly closed, as in photophobia. The skin thus drawn upon is thrown into folds, especially radiating from the lateral angle of the eyelids. These folds become permanent in old age, and form the so-called crow's feet. The levator palpebrae superioris is the direct antagonist of this muscle. It raises the upper eyelid and exposes the front of the bulb of the eye. Each time the eyelids are closed through the action of the orbicularis, the medial palpebral ligament is tightened. The wall of the lacrimal sac is thus drawn lateralward and forward, so that a vacuum is made in it and the tears are sucked along the lacrimal canals into it. The lacrimal part of the orbicularis oculi draws the eyelids and the ends of the lacrimal canals medialward and compresses them against the surface of the globe of the eye, thus placing them in the most favourable situation for receiving the tears. It also compresses the lacrimal sac. The corrugator draws the eyebrow downward and medialward, producing the vertical wrinkles of the forehead. It is the frowning muscle, and may be regarded as the principal muscle in the expression of suffering. 4c. The muscles of the nose. The muscles of the nose comprise procerus, nasalis, depressor septi, dilator naris posterior, dilator naris anterior. The procerus, pyramidalis nasi, is a small pyramidal slip arising by tendinous fibres from the fascia covering the lower part of the nasal bone and upper part of the lateral nasal cartilage. It is inserted into the skin over the lower part of the forehead between the two eyebrows, its fibres decussating with those of the frontalis. The nasalis compressor naris consists of two parts, transverse and alar. The transverse part arises from the maxilla, above and lateral to the incisive fossa. Its fibres proceed upward and medialward, expanding into a thin aponeurosis which is continuous on the bridge of the nose with that of the muscle of the opposite side, and with the aponeurosis of the procerus. The alar part is attached by one end to the greater alar cartilage, and by the other to the integument at the point of the nose. The depressor septi, depressor alae nasi, arises from the incisive fossa of the maxilla. Its fibres ascend to be inserted into the septum and back part of the alar of the nose. It lies between the mucous membrane and muscular structure of the lip. The dilator naris posterior is placed partly beneath the quadratus labii superioris. It arises from the margin of the nasal notch of the maxilla, and from the lesser alar cartilages, and is inserted into the skin near the margin of the nostril. The dilator naris anterior is a delicate fasciculus, passing from the greater alar cartilage to the integument near the margin of the nostril. It is situated in front of the preceding. Variations. These muscles vary in size and strength, or may be absent. Nerves. All the muscles of this group are supplied by the facial nerve. Actions. The procerus draws down the medial angle of the eyebrows and produces transverse wrinkles over the bridge of the nose. The two dilatores enlarge the aperture of the nares. Their action in ordinary breathing is to resist the tendency of the nostrils to close from atmospheric pressure, but in difficult breathing, as well as in some emotions, such as anger, they contract strongly. The depressor septi is a direct antagonist of the other muscles of the nose, drawing the alar of the nose downward, and thereby constricting the aperture of the nares. The nasalis depresses the cartilaginous part of the nose and draws the alar toward the septum. End of section 28.